Losing weight, toning up, it's never easy. But what if we told you there was a way to melt fat using lasers? If you're skeptical, trust me, you're not alone. Joining us now to explain is Dr. Paul Glat. He practices in Bala Cynwyd. Thank you for coming in this morning.
Thanks for having me.
Okay, so this is called SLIM Lipo,
That's right.
And you use this in Bala Cynwyd.
Yes, I do.
How does it work?
Well, SLIM Lipo stands for Selective Laser-Induced Melting. So it's actually an adjunct or an advance in liposuction techniques. It's a laser that actually goes under the skin and then actually melts the fat and also can tighten the skin. Okay, you have some before and after pictures that you brought in. We showed a picture earlier this morning of somebody's chin. Correct. So is this anywhere then on the body that you want to quote-unquote melt fat? It can be used anywhere on the body, but the areas where it's really very beneficial is areas that you might not have thought you were a good candidate. So like this? The abdomen, the neck is really a great area for it, especially people where you want to tighten the skin. The back area is terrific for it because it literally cuts through the fat like a knife through a hot knife through butter. Wow. So it's areas that really were not good for liposuction in the past that this can really be an adjunct. Women, sometimes this area and the bra area, the love handles are a great area. Now we've seen, TV, obviously, when they show liposuction, they've got this big, thing that they're sticking in, and you see the surgeon doing this back and forth and fat, coming out. So it looks drastic. Correct. Is that why this is becoming so much more popular, you think? This is great because it's a very small incision, smaller than standard liposuction. But there is an incision. There is a small incision, about 1 to 2 millimeters. The device is passed under the skin, and then it's literally like very atraumatic. You can almost, it's like playing a violin. You can go right through the tissues. And you're just burning it? You're melting the fat very safely, and then what you do is go back in with a much smaller cannula, like you've seen previously, and it takes out the liquid fat. So it's much less traumatic, the bruising is much less significant, and therefore the recovery is much more rapid. Well, here's what a lot of people want to know. How much does it cost? Well, it really depends on what areas you're getting done and where we do it. This has really allowed a lot of people to come back into the office and have it done without general anesthesia, so there's some cost savings there. Like thousands of dollars, $10,000? It's usually about $2,500 to $3,500 per area. And then how much would lipo be? Lipo is about the same. Okay. So it's really not a significant cost increase. But the nice thing is if we can do it in the office, if you're a candidate, you can save money that way. And I've heard some people are doing it and then they're getting back to work within a couple of days. Literally a couple of days, yeah. Wow. So let's talk about then finally, who is this not for? Obviously everybody can't do this. I mean, this is really not a specific weight loss or a very large body reduction type of situation. It's great for people who may not have been candidates before with a little bit of loose skin that we might have turned away, the inner thighs, maybe someone who was thinking about a tummy tuck, this thin person with some extra skin in the neck, that this really can effectively tighten those areas where previously we couldn't. But it's really not a weight loss procedure. Okay, well, I remember sitting across from a surgeon years ago talking about Botox and whether he thought that would catch on, and now look. So you just never know what's going to be the next big thing. Do you think this could be something that's going to grow? This has really been a major advance in body contouring and facial and neck contouring procedures for us. Well, Dr. Paul Glat, thank you for coming in and telling us about it. Thank you so much. All right.